I did a lot of research all across the West Coast when I was looking for a community health center to join. And this is one of the first occupations that I've ever had where when I come in Monday morning, I love coming in to work on Mondays.
The difference between a community health center and an independent practice or a group practice, as a provider you have an opportunity to work with individuals that really appreciate your care.
I think by having the clinic there and having the sliding scale in particular, it allows people to not only obtain the health care that's important to them and their families, but also to do it with a sense of dignity. Because if they can only pay $10, they can pay $10.
Part of the reason why doctors go into their professions is to help people. And they always talk about how you want to use your services for good, that you want to give back to your community and you want to make a difference in it. And this is one of the ways that you could practice what you preach and really give back to the community in a way that's not only rewarding to see the people that you help out, but also to have that incentive like the NHSE Scholar or a loan repayment program. Working here at Siskiyou where you can do both, it's a huge asset to not only your career, but also to the patients that you help. And to be able to share that bond and share that moment with people is amazing.
Grants Pass really has a small town feel to it. I see my patients in the grocery store and at the art night. You really feel a bond with the community.
I chose Southern Oregon because it really is an outdoor mecca. Good schools, small enough community that it's not a big city, but big enough to where you have most of the things that you need.
My favorite event in Grants Pass is the Growers Market. It's wonderful. We walk down there every weekend, meet the farmers, meet the people producing.
Oregon's a very special place to live. It's got some of the most beautiful natural wilderness. It's an hour drive to the ocean. It's an hour drive to skiing and snow sports. We're surrounded by wilderness. We have one of the best national parks around with the Oregon Caves Monument. There's hiking, fishing, rafting, swimming. There's a very large community of organic gardeners and farmers who have farmers markets all through the summer.
Family is a big deal in my life, and so one of the priorities that I had in choosing what I wanted to do with my career was find an occupation where I could balance my work life along with my family life.
The ability for me to practice medicine the way I wanted to, and I really did enjoy the readiness of, administration presenting themselves to take care of all the things that I needed and explaining everything to me and letting me know that they'd work with me. It's a nice and very well managed clinic. I don't think I can compare it to most FQHCs out there. I think it stands above that in terms of how the setting is. It almost looks like a private practice setting.
Siskiyou Community Health Center has individuals on staff that do all the billing, do all the credentialing, do everything that an independent physician would have to do on their own or hire people to do for them.
The team effort, the fact that all the employees that handle everything, the billing department's here in-house and I can go to them anytime I want. IT is in-house. I really want to focus on my patients and I don't want to have to worry about the stressors of finding ways for them to get care. I just want to give them the care, and at a community health center they can get that.
The nice thing about our size practice is there are colleagues right down the hall. We support each other. We have other resources that we can draw from to assist patients with medical issues, financial issues, socioeconomic issues, life challenges.
We have procedure rooms available. At this point we have a lot of things in place to do extra and outside of just office patients. We can do the procedures. And
the administration gives us the flexibility to stay out of our business and say, you know what, you treat the patients how you want them to be treated. They don't give us any limitations, and by not doing that, I have the freedom to say, you know what, I need to treat you and it'll take 10 visits, or I need to treat you and it'll take 2 visits. We are given that freedom and that liberty to be able to take care of the patients how we were taught in school.
The community of Grants Pass has people from a wide variety of socioeconomic backgrounds, and our clinic practice reflects that. I came to Siskiyou 15 years ago as a health service corps scholar with a 3-year commitment, and I'm still here.
As a loan payer recipient or a scholar recipient, a lot of times you have this impression that if you go to a community health center, it's going to be a risk in your career. On the contrary, it's not that way at all. In fact, it's a blessing for your career, especially if you're starting out just graduating from medical school or just graduating out from dental school. This is the perfect environment to come see patients because you see everything. And you have just as much training here as you would outside in private practice.
So a year ago, I became the Chief Medical Officer at Siskiyou Community Health Center. I've been able to continue delivering babies, which I love, without having to worry about the impact of malpractice coverage on my practice. And I've been able to do this in a clinic where I feel that I'm supported, I have the support of my colleagues.
Administration offices always have an open door policy between the CEO, CFO, and COO. That's huge.
Siskiyou creates that environment where I can leave work at work and come home and be at home with my family and enjoy my time with my family. Let's say I work 8 to 5. By the time that 5 o'clock rolls around and I'm done with work, I'm done. I can go home and not worry about the stresses of as if I was a business owner and having private practice. I don't have to worry about payroll or how am I going to get the next patient. I can go home and enjoy my family life without having that burden on my shoulder, knowing that I have to worry about things at home. So I can leave work at work and come home and play with my kids and go on the activities that I wanted to do, or do the things that I need to do in my own personal life to take care of me and not worry about what's happening at work.
One of the greatest rewards is to be able to follow families through time, and we have clients here that we've taken care of for 3 generations.
And few patients, 1 or 2 patients a day say you a thank you. That is a sincere thank you, you know. They're saying, we are glad you're here. That makes a big difference.